Are you able to hear me? Are you able to hear me at all on here?
Yes, we can hear you.
Okay. We have 4 committee members or 4 board members, correct? That are on here right now.
Yes,
And that constitutes as a quorum.
yes, it does.
Okay. Van emailed me last night and that he's busy with the Veterans Day ceremony today. And Ingrid's going to be late, and I have not heard from Tim yet.
Well, it looks like Tim just got on. I see him now.
Okay. My computer is doing an automatic update on me, so that's why I'm on my iPad, and I may switch off of this and go on my computer once that's done. So you may lose me for a little bit. I guess I'm going to go ahead and call this meeting the Health and Human Services Board together on November 11th at 10:32 a.m. Was this meeting properly posted?
Yes, it was.
Wonderful. Now I'm going to entertain a motion to approve our 14-point agenda.
I'll make a motion to approve the agenda.
We got motion by
I'll
Dyke,
second.
seconded by Cindy. Any discussion on our agenda? All right, all those in favor signify by saying aye.
Aye.
Opposed, say nay. Motion carries. All right. Agenda item number 2 is approve our October 14th, 2021 Health and Human Services Board minutes. Are there any additions or corrections to the board minutes? Hearing none, I would entertain a motion to approve those minutes.
I'll move to approve the minutes.
A motion by Dr. Barris. Is there a second?
Second.
Seconded by Timothy Gotchel. Any discussion? Hearing none, all those in favor signify by saying aye.
Aye. Aye.
Opposed, say nay. Motion carries. Agenda item number 3, are there any citizen comments? Do we have any citizen comments? Okay, hearing no citizen comments, I will move on to agenda item number 4, our director's report.
Thanks, Mr. Chair. So you may have heard about the recent emergency CMS and OSHA regulations requiring COVID-19 vaccinations for workers. As you probably know, CMS stands for Centers for Medicare and Medicaid Services, and OSHA is the Occupational Safety and Health Administration. So these new regulations do raise some questions for us at Health and Human Services. The OSHA rule does not directly apply to Wisconsin public or government entities, but it is unclear if Wisconsin's regulating authority that enforces those kinds of work rules will adopt the OSHA vaccine mandate. It's also not clear yet if the CMS regulation would apply to the entire Health and Human Services agency, or possibly just those programs that receive Medicaid and Medicare, or possibly not at all if we are not classified as a Medicare, Medicaid certified facility, or if we don't fit into one of the provider types that are outlined by the rule. Our county administrator and corporation counsel are also evaluating how this law applies to us. Like most other counties, we're waiting for more information from the Wisconsin Counties Association legal review, which should be coming very soon. Our corporation council has advised that we, until we have greater clarity, we have no means of enforcing a mandate, and so we would err on the side of preserving the status quo. And once more information is available, then we can decide how to go forward. In other agency news, we continue to follow the CDC guidance and wear masks in all parts of our building, regardless of vaccination status. Our staff are providing in-person services, but do make virtual services available in many cases. In behavioral health, the coordinated services team staff are working with providers to put together a diversity training that focuses on working with at-risk youth. This would be provided next month. Adult protective services staff are completing the last of protective placement reviews for 2021. These reviews are required legally in order to assure that individuals are placed in the appropriate levels of care. A total of 46 reviews have been completed so far this year, and these are presented to the court. Child and Youth Services submitted applications to the Department of Children and Families for targeted safety support, for illegal services, and promoting safe and stable families. These programs apportion an additional funding beyond our base DCF allocation to provide supportive services to families and address legal issues to keep children safe. These programs are especially important as we assure our compliance with the new Federal Family First Prevention Services Act. We had planned on providing a presentation on Family First this month, but because of some other agenda items, we've postponed that to a future meeting. Our tracking of the Promoting Safe and Stable Family Services shows that we've assisted 60 families and a total of 87 children so far this year with prevention services, reunification services, and youth empowerment and mentoring services. This is a significant increase over last year with a significantly higher outreach to at-risk families that is provided by our youth aid worker and our part-time family preservation worker. In economic support, the state system that is used for the call center is being replaced. The new system, which is called Genesis, goes live November 19th. Our staff have received training on the new system this week. We expect that there will be an adjustment period as we work out the kinks, so we ask everyone to be patient. And if individuals are experiencing difficulty getting through, please encourage them to keep trying because there may be some glitches on and off. As we mentioned last month, the food share program has been scaling back its temporary pandemic policies. Recipients will continue to be exempt from the work requirement under food share until September of next year. Despite that, we're still encouraging individuals to volunteer for the food share employment and training program. This is also known as FSET. FSET is a no-cost program that helps food share recipients build their job skills and find jobs. It's a crucial part of getting people back on their feet. Healthcare recipients continue to be eligible for their benefits during the public health emergency, regardless of their actual eligibility status. This emergency status is currently set to end January 16th of 2022. The planning phase has begun to wind down the temporary program policies, but a 60-day notice will be given to recipients before any benefits end. Recipients will receive a letter requesting that they complete their renewal. The notices will be staggered so as not to overwhelm all of the income maintenance agencies and will be based on how long the recipients have gone without a renewal. The ADRC is working with Medistar to restart our Caregiver Coalition. This coalition will bring local stakeholders together to work on projects that affect caregiving in our community. So far, we have had 2 get-to-know-you meetings and have had a great response from our community partners. Medicare enrollment session, the Medicare enrollment season has started. Joanne Welch, our ADRC's Elder Benefits Specialist, is assisting individuals with reviewing their current Medicare Part D plans to determine if they're the best plan for them. In the first 3 weeks, Joanne has already received over 40 requests for assistance. The ADRC also provided a Dementia Live training for our Health and Human Services staff who had not previously received it. Dementia Live is a high impact dementia simulation exercise that immerses attendees in the life with dementia. This creates a better understanding of what it is like to live with a cognitive impairment. A total of 11 staff members attended the training. And that's my report, Mr. Chair.
Thank you, Tracy. Are there any questions or comments for Tracy?
Mr. Chair.
Go ahead, Mr. Gotchel.
Tracy, do you know if the county has prepared a medical waiver or religious exemption process if and when a vaccine mandate comes down?
At this point, no action has been taken, either countywide or within Health and Human Services. We're still waiting for direction. That would be the next step. That's part of the regulation, is that you need to have that and put that in place.
Okay. Would Health and Human Services be at the forefront of creating that procedure, or would that be something from the Office of the Administrator?
That's a good question. It probably depends a little bit on whether it's if OSHA is going to apply to the whole county, it may come from the county administrator. I would imagine that Health and Human Services might be involved in assisting with that. If it's really OSHA is not going to apply to our county and instead it's CMS, I imagine Pine Valley and Health and Human Services would be the 2 agencies that are most involved.
Sure, that makes sense. Thank you.
Any other questions? Let's move on to our next agenda item, number 5, health officer update. Rose?
Hello, good morning. Yes, I wanted to give some case statistics for Richland County, as I do at each of our meetings. And this data was effective as of yesterday afternoon. So of course, some of it is a moving target. So I expect some of the numbers may definitely be different as of this time. But according to information that we have gleaned from the Department of Health Services, as of yesterday afternoon, Richland County has had 2,190 positive cases for COVID-19. There have been 9,732 negative case counts. 161 individuals have been hospitalized. We have experienced 26 deaths, and I will admit that we had 2 probable deaths listed in a separate category, but that has since gone up to 3. Currently, and again, as of yesterday afternoon, we had 109 active cases and 70 individuals have been released from isolation in the last week. Just to give you some information regarding the amount of pressure that our staff have been under since August, including the data from August, September, October, and to date for November, we have managed 840 cases since, including the month of August. So it has been a steep climb. And it's been, when you look at it, that's more than a third of the total number of confirmed cases that we've seen in just the last 3.5 months. We had 432 positive cases in October, and that number exceeded any other month to date since the pandemic began. we've been given some mercy. I can't talk today. Mercifully, I guess is the term I want to use. We've only had 37 cases here in November as of yesterday afternoon, although more have come in today. So hopefully we'll get a bit of a break, and we need that desperately just because of the level of burnout that I see happening. Our staff are dedicated, and they have been working tirelessly to assist with the health and safety of staff. Maybe it's my own feelings of burnout. It's been a long haul. So, and so you can tell just by the numbers alone of the objective data that we've been working with. As far as disease transmission, the CDC has us at high, and that's the highest level that they provide for any county in the United States. However, with the Wisconsin of DHS, they have placed us at a very high level of COVID-19 transmission, and that has come down and has been maintained over the last 2 weeks. Prior to the last week in October, we were running at a critically high level. So, and that was borne out in the numbers that I provided. As far as vaccine acceptance, here in Richland County, of all the ages of individuals who are eligible for COVID-19 vaccine, 55.5% have had or have accepted at least one dosage, and 53.2% have completed the series. And those folks who are equal to or greater than 18, 65.9% have received at least one dosage, and 63.3% of those equal to or greater than 18 have completed the series. So just want to provide that information to you. And I know, Tracy, you have data and statistics that you can show to folks as well.
Yes, I did include much of the information that Rose is referencing is in your board folders, so you can have access to that.
And then with regard to our nutrition program, it's really sad that all public health is COVID anymore. I mean, we are providing flu vaccines to the schools, and also we've gone out to 2 different entities to provide vaccines. And these are entities where we normally give it every year. I'm just looking at my supply of vaccine to see how much we can make available to the community, and then the time frame for such. We're also doing our usual childhood immunizations, skin tests, all of our other communicable disease work and the like. So lots going on behind the scenes. And we are seeing folks in person, although I think that we're seeing fewer folks overall. With regard to nutrition, they are offering hot home delivered meals now. They had not been offering that option for a long period of time. However, that is now being provided to meal site participants 3 days per week, I believe on Monday, Wednesday, and Friday. The grab and go hot meal option does continue as well, and people are able to pick up that meal Monday, Wednesday, and Friday at the campus. So it's actually prepared there, and folks are actually able to come and pick up what is a carry out, and they call it a grab and go process. It kind of helped at least initially to bridge the gap for folks who wanted to have hot meals. The frozen meal delivery continues as well, and we still do that in bulk. Some folks get a larger number of meals as long as they have storage capacity for that. And then the meal sites continue to be up and running. We try to increase safety measures to whatever degree we possibly can, and including encouraging masking if folks will do that, but maintaining social distance and the likes. We just are trying to keep the safest options available for folks who actually decide to come on site to participate in the meals. And then there's always a need for volunteers. So if you know folks who might be interested in being a volunteer for the nutrition program, they really could use that extra help right now, especially since they've reinitiated some of the home delivered meals.
Thank you, Rose.
You're welcome.
Is there any questions for our health officer? Comments, concerns? Okay. Thank you. Number 19, we got expenditures report, vouchers and expenditures over 2,000, but less than 10.
Hi, did we lose him?
Yeah, I'm not sure if Carrie, can you hear us? Oh, I know he's switching
Must have
over
in that reboot.
laptop
Oh, he's in that
Yeah.
land.
Yeah,
I
I
just-
think we lost him.
or to his computer and maybe not laptop.
All right. Should I just go on then?
I think that's okay. If anybody else from the board objects, please do speak up.
No, okay. I'll go ahead and start. So these, I went through all of these vouchers yesterday with Clint and he already signed off on them. So checks are getting cut today and going to get sent out. So this is just kind of a review of some of the expenditures for the month. If you kind of, the first section is always the mileage transportation program reimbursing our volunteers. So we can skip to page, what is it, 3, I believe. There we go. If you look at number 20, maintenance, cleaning supplies, $853.87. That was for some, and Angie, you can tell me, I'm going off of the, if I was wrong, but we had some keys and locks, stuff done with keys and locks, various around the building. And then if you go down to number 17, the $1,325.76, that's just our monthly carryover bill. That's going to happen on a regular basis. Jumping to page 4, just note that I'm just highlighting a couple of the credit card bills that were paid, which had a total of $5,416 charged to it. So if you go back up to the number 14 as a highlight, $533.36. Those were items purchased for the home delivered meals program. Go to page 5. We just had our bill for our e-panic button. If anybody doesn't know what that is, that's on the desk, on a few of the desktops up, especially up at the front. If there's an escalated situation up front, then the staff at those desks can notify management to come help out in an escalated situation. If we go down to number 76, $2,125, that's our quarterly payment for our environmental services for Troy Morris. And then we had a couple of JComp technology bills come through right below that, 31 and 32. 31 was for some SmartNet server switches. You'll have to ask MIS what those are for. But those were actually something that we had to take care of way back in July, and they just got billed through, we just got the bills from MIS for that. And then the $2,198.99 was also for a computer that we purchased back in July, June, I believe, June or July. And that was for the Children's and Youth Services unit. And that was, again, we just got the bill for that. So if we go back to page 5, at the bottom there, Johnson Controls, Inc. That's our fire, those are our fire system people, the $902.45. That was for a site survey. They came in. We're working on expanding the fire alarm system throughout the building. Simple enough explanation, right, Angie? If we go to page 6, if we go down to number 38, Nutri Systems Corporation, $697.28. That is, again, more home delivered meals, equipment, supplies. If we go down to $679.96, number 40, that's miscellaneous supplies that we purchased due to, COVID needs. And of course, that'll get covered by COVID money. Page 7, just note the total on the Richland Observer of $812.28. We had to do various ads for hiring because of vacancies, and there was some. Roxanne can correct me on this too, but she had to have public hearings for some of the plans and things that she had to submit. So those were the ads for that. The next 3 items, 53, 51, and 52, those are all for flu vaccines. So those we do have to pay for. And then, so we received a supply of flu vaccines and we had to pay for those with a credit coming back for from what I understand, was for vaccines left over from last year that we couldn't use this year. Jump to page 8. Note the total for shopping news of $776. Again, the same kind of things. Ads for vacancies, hearings for the different plans for the ADRC or through the ADRC. Right below that, number 57, Strang Heating and Electric, $1,938. That was for replacing 22 light ballasts throughout the building. And if we go down to number 67, $1,731, we installed, it's called a water cooler, a bottle thing, so we can use the water cooler again, and it actually has a bottle refill piece to it. I don't know what you want to call it, whatever. So we had to do that. And then right below that, $450.43, just a plumbing fixture that needed to be fixed. Let's go to, if we go 9. Yeah, that's pretty much it for the main vouchers. And then we did have to, went ahead and paid some vouchers. On page 10, we received the bill from JComp Technologies for all of the computers that were approved through the county board resolution. So that bill came through, and that total was $50,698.88 if you add all those up. And then the other ones are just miscellaneous bills that if we pay ahead of time, we avoid late fees. There's due dates on them. And DocuSign was also something that was pre-approved back in September. And this was the bills coming through. So we just went ahead and paid those because they'd already been approved. So those are the vouchers I went through with Clint, and he signed off on them, and checks are getting cut today. Anybody have any questions or? Nope. Super.
Hi, this is Carrie. I just want to let you know that I'm on the phone right now.
Okay.
I got some internet problems here. Tim, do you think that you can take over for a little bit and I'll still listen?
Sure can.
Okay, thank you.
So it looks like we are now moving on to item number 7, 2021 budget summary and Richland County placement report.
And I didn't even turn off my mute, so don't have to remember to turn it back on. So the board report, you're going to see out there that I literally just loaded a corrected board report about 10 minutes before the board meeting, and Tracy has that pulled up here. So through October, we should be at about 83% utilization. And so just I have some notes to kind of highlight the percentages as we kind of go down. Building and operating costs. The big highlight there is 101%. What happened is all of the workman's comp insurances, all those other various insurances hit our books, and so those got charged to us, and we had to pay those. So that's what those showed up. The reason it is so high is the numbers that we had received to create our budget for 2021. The actual bill itself ended up being significantly higher than what the original projections were on what that cost was going to be. So that's why that is higher here. If you go down to public health, 117%. Again, that's just the, as Rose was talking about earlier, a lot of work's being put into the into public health for COVID. For various expenses in that area. We do have COVID funding though that we can tap into to offset that. If we move down a little bit, just kind of wanted to point out some various services, elderly services, nutrition, those kinds of programs. Earlier in the year, it was kind of slow going, and as you know, meal sites weren't open, things like that. But as we're going along, those numbers are increasing, services are happening. But it's just going to show that expenses are a little bit lower than were anticipated. Then also too, it might be a little below the 83% resource center, economic support, children and youth programs, a lot of vacancies. That usually is the biggest reason for those being so a little bit lower. Oh, where's my note here? Like I said, various programs, vacancies, some positions weren't, so like in mental health outpatient crisis services, there were a few positions that we just haven't been able to fill for the whole year even. And then if you look at like the children and youth services, contractual services, and then in a couple of the other areas like AODA and treatment court and CLTS, just we didn't, the service utilization is just a little bit lower, contracts, lower utilization of contracts. On the flip side for CCS though, that service utilization is on the rise. I do want to also point out the APS is only at 45%. We've had a vacancy in that position. Plus we also, we had a vacancy in that position though recently. And then there was an APS crisis position that was budgeted for that we didn't fill. And Tracy's nodding. So hopefully I'm telling you all the correct information in that regard. So yeah, so that kind of is a highlight on where we're kind of at overall. Currently, we should be at 83%. And if you look at our overall budget, we're at 81%. So some areas are higher, some are lower, so it all balances out. So then if we move over to the core budget balance through the middle here, yes, so it is. So this is our balance through October. So these are expenses through October. So then what we do is we try to kind of anticipate what is our, we have some revenue that we are anticipating getting, and this really is just claims that have been submitted, but against the October expenses, we just haven't received that money yet. So those are anticipated there. If we go down just a little bit, and this is where the corrected version comes in, everybody. I had to fix the anticipated expenses. I had originally had not included these chargebacks, the chargebacks right below that that we need to move around, that they take away from us, and then we get the cash back into our core budget. So so the chargebacks, I added that back in there. So so that's the anticipated expenses. And then when we look back down, so then we can look down at our new core year-end projection after anticipated revenue expenses and giving us back that chargeback. We're looking at a positive balance of $162,083 or $162,083. So that's what we're looking at as of October. So,
All right. Oh, go ahead.
Any questions? I mean, we'll keep moving if you have any. No?
I can talk about the placements then, if that's all right. Switch over to our placement report. So as you can see for Fund 54, our adult institutional and inpatient placements, the utilization has been lower, as you can see in the last few months. We expect to probably see a higher number in October though, just to let you know. So we are still trying to utilize crisis stabilization either to shorten or divert away from the need for institutional placement. So our adult crisis stabilization expenses as of September are $49,007, and adult institutional placement expenses is $92,595. And with adult community residential placements, you'll see that the number of placements decreased slightly in September with, I think, just one individual moving back into the community. I also want to note that you'll see that the county expense for September is substantially lower than previous months. And you'll note that we've been incurring a high cost for placements for that very high cost CCS placement. And as we move on toward the end of the year, we're trying to move those costs back into the core budget and thinking that we're going to be able to cover them. Ideally, when we see our WIMCR reconciliation in December, we'll know how much reimbursement we are getting for that high cost placement. And that will let us move forward with our goal of putting all CCS expenses into the core budget because they would be reimbursed by Medicaid. So our adult residential placement expenses are $373,373 through September. So looking at Fund 54, the adult placement fund, we started the year with $482,278. We have a total dollar amount of expenses of $514,975. So that does mean that our placement Fund 54 goes into the negative by $32,697. Looking at children's placements or Fund 44, institutional placements and detention placements. For child institutional placements, we have had $165,950 in expenses through September, and detention expenses are $23,400. And with child foster care and treatment foster care placements, $320,580 is the group home and treatment care expenses through September, and $21,854 is the regular foster care expenses. So for all of Fund 44, we began the year with $527,341. We have had a total dollar amount of expenses of $531,783. So Fund 44, the children's placement, also goes into the negative now at $4,442. Now I'll show you a little bit of some comparisons. So this chart shows you the monthly placement costs. The dark blue is the 2021 expenses. You can see that 2021 has been a little bit lower than previous years in terms of placement expenses. And I'll also show you kind of the overall total year by year. And this is our projection right now of ending the year for 2021 at $1,390,678. This is a point in time, of course. So if all of our expenses continue for the next 3 months as they have, that's about where we should expect to land. I am pointing out that we did see a higher number of days of institutional placement, so that will influence this number. And then finally, just to give you a little bit of idea of the different placement types where we expect those to land. With adult institutional inpatient placements, we're trending to end the year at 123,000 roughly. That's much lower than we've seen in many years for institutional costs. But you should note that adult community placements are way up, expecting to end the year at 497,000. And I know it's redundant, but again, to remind you that that's due to that very high placement cost that we have there. That's helping us reduce the institutional expenses to keep that individual in a community-based placement with the expectation that we'll get more Medicaid reimbursement to help cover that cost. Adult crisis stabilization looks to end the year about 65,000. And with the different types of children placements, child institutional residential has stayed pretty steady. Looks like we'll end the year somewhere around 221,000. Juvenile detention looks to end the year about 26,000. Child group home and treatment foster care, that's the one that we're seeing quite an increase in. We've had some more placements this year. That looks to end the year about 427,000. We don't have very many regular foster care resources in the community, but we are also using treatment foster care because of some of the special needs of the children who are placed, as well as the efforts to try to keep sibling groups together. And I believe that is the whole report. Does anybody have any questions?
So hi, I'm back on. Got my internet figured out, I guess, for now anyway. So thank you, Tracy, for your report. Is there any other questions for Tracy regarding the placement report? Okay, then let's move on to where we at? Number 8?
Yes.
And item 8, which is preliminary 2020 post audit report.
So I think we did something similar last year. I'm showing you a table that Stephanie and I have worked on. The auditors have now completed their work for 2020. And Stephanie and I had a call with them earlier this week, just to help us understand kind of how did Health and Human Services end the year. So with that information that we received from the auditor, we kind of put this together to try to illustrate how the year 2020 ended for Health and Human Services. So I'll show you the top orange table is our core budget, and the blue table below it reflects the placement costs and reimbursements. So the first column, 2020 approved budget, this is the budget that we started the year with. And so started with $6,894,000 in expenses, with also corresponding revenues. And down below shows you where the placement, the tax levy that was put into the placement funds. The estimated year-end balance, you may recall that back in March, we did an estimate of where we thought we would end the year and gave a report to the board on that. So we did expect to have fewer expenses and more revenue coming in. We did kind of a pretty involved detailing of why we anticipating ending the year with so much in remaining funds. But we expected to end the year with $564,000. So following the column down, we also expected to end the year with $1,723,000 in placement expenses, which was more than the tax levy could support. So if, and what the auditors typically do is they take whatever might be remaining from our core budget and cover the placement costs. And then if there's still a deficit, that money has to come from the general fund. And if there are remaining funds, that money goes back to the general funds. So back in March, we were expecting to have a $150,000 deficit after the placements were covered. So with our meeting with the auditors, what we learned is Health and Human Services actually ended the year with a larger balance, $782,026, which was more than we expected. We're still working through some of the audit report and trying to identify what factors influence that. But what that means for the Health and Human Services, both our core budget and then the placement funds, is when we ended the year, the auditors determined that we ended the year in placement expenses a little lower than what we projected, $1,659,000. Then applying the $782,000 from our core budget of that remaining balance, that will leave $132,580 to be returned to the general fund. So I think that's good news in general. Certainly many of the factors that impacted that higher balance of remaining funds, we've addressed in our 2021 budget. We don't expect that to happen again, although with the COVID funding that we really didn't plan for, or some of those factors, we may see potentially see some remaining funds again in 2021. So I just wanted to share kind of where Health and Human Services ended up. I know that the auditors are going to do quite a large presentation to the Finance Committee and to the County Board in December. But this was our conversation with them to help us understand just our department. Does anybody have any questions?
Have we gave back $100,000 before in the past?
Are you talking about the previous year?
Yeah, like the previous years, like
Yeah.
18, 19, 20.
So
for the
I don't have the exact amount, but in the 2019 budget ended with a very large return to the general fund of $550,000 roughly. So that was after placements were addressed. And I think a big factor in that was we had instituted that chargeback so we could keep the Department of Health Services allocations to fund programs. And so that offset some of the budget was not built with expecting to get that funding. And so that meant that we had more funds available, which offset the tax levy that we needed. I saw a little nod from Tim, who certainly was involved in building that budget. So it sounds like that sounds accurate to you, Tim.
Yep, that's accurate. Well done this year and last year. It was just an amazing story. We can fund these placements and give back to the general fund. That's amazing.
Are there any other questions for Tracy on agenda item number 8? If not, we can give a warm welcome to Ingrid. She just joined us now. And let's move on to agenda item number 9, our 2021 contract monitoring report.
Okay, so there it is for you. So in reviewing the contracts for 2021 and all the expenditures that have come in, roughly September was where most of the bills have been trickling in. There's a few you'll see that are October, but mostly September. So that percentage is 75% of the year. So on the far right-hand side, the percentage utilized, I'm looking for anything over that 75% mark, which there are a few on the first page. Just 4 down, the Children's Hospital of Wisconsin. It is tipping over 75%, but they did invoice us through October. So that should be just fine. And just below that as well, the same story with Toledo, over 75%, but bills coming through for them were through October. So page 2. Right in the middle, the Artisans Shop is at 95% utilization. However, I believe that is I believe they do fencing. It's a fencing for children with long-term support needs. So I don't believe they plan on using that anymore. I would say that is probably the fence project is done. at the home that they, or multiple projects. I think there might have been 2. So the fencing is done, and I would guess that would trend just fine right through December. Page 3. In the middle again, Premier Financial Management Services is just tipping just a little bit over 75%. So we'll just continue to keep an eye on that. Page 4, same thing, driftless counseling right in the middle almost, just tipping a little bit over 75%. So we'll just continue to watch that. The top of page 5, the one we mention every month, is Cario. And that has, they have billed us through October though. So that is the same situation where it should be just fine. They always bill us a month ahead of time. Page 6, I did not see anything there that was over 75%. And the last page, the same. There's just one there that's we haven't spent anything with. So any questions for me on 2021 contract monitoring?
Are we about average? Do you believe with
Yeah.
our contracts? Yeah.
Yeah, it's every year, you know, there's a lot that frustrates me a little bit. There's a lot that we've pushed out that we have spent nothing with. So that's just a lot of workload on my end, and we don't ever do any business with those people. So that happens a lot, but I monitor them all, I track them all. So we're trying to balance that out a little bit more to where it's a little more realistic and we're not just throwing contracts out there just in case. Some you have to as a backup plan, but mostly if we're going to put out contracts with providers, we want to usually have intentions of doing business with them. So new for 2022, the DocuSign bill that you saw on the vouchers this month, that's something that I'll be transitioning to. So instead of those paper documents, we'll be doing everything electronic. Doesn't mean we're any faster in the process yet because it's rebuilding everything and starting over from scratch, but I'm hoping that it will help be more efficient in the next month or 2. And hopefully we'll get 2022 contracts out well before January, February or March. Sometimes we're still doing them in March of that same year. So looking forward to DocuSign.
Are there any questions for our contract monitoring? And let's move on to agenda item number 10, which is approved contracts, agreements, and amendments. That seemed pretty light this time.
Yeah, so there's just one new contract provider for 2021. So just talking about this year for $20,000, Brown's Living. I can't see everybody. If Miranda's on, if she wants to talk about this.
He is not on.
So what I do know about it is, it is an adult family home. So I believe they're transitioning someone into this facility, and that would be through the remainder of this year. I'm not sure. She has not given me anything for 2022. So I'm not sure, Sharon, if you know if that's continuing or the intention to continue in 2022 or just this short stint.
I am not aware of that. We're just still waiting to see.
Okay. So this would be just to push this one out for 2021 for $20,000.
A motion would be appropriate to approve Brown's Living LLC.
So moved, Ingrid.
So Ingrid Glassbrenner moves for approval of this contract. Is there a second?
I'll second, Diane.
Seconded by Diane Cox. Any further discussion? Any discussion? Hearing none. All those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. Item number 11, we got personnel updates.
Yeah, I don't usually just share the whole memo on the screen, but we have quite a few updates to share with you today. We have several staffing updates. So new hires, Kayla Williams, who has been the Child and Youth Services Supervisor, has taken the position of Disability Benefits Specialist, which was a vacant position. She will start on the 22nd. Amanda Ullman has been hired as Economic Support Specialist along with Darian Ostrowski, also Economic Support Specialist. They will start on the 30th. And Emily Phelps will start as a new Child and Youth Services Case Manager also on the 30th. And then we have been able to hire a psychiatric nurse, which is very exciting for us. Kelly McCann will start on the 13th of December. No probationary period, discipline, termination issues to report. But we do unfortunately also have to report some resignations. Jennifer Hamje, Information Assistance Specialist in the ADRC, resigned effective the 12th of October. Joe Scribbins, who was recently hired as the APS worker, is going to be leaving that position effective the end of this month. And Edie Arneson, formerly Edie Moore, the CCS supervisor, is also going to be leaving her position as of the 17th of December, unfortunately. We also will let you know that Dennis Drake, our custodian and janitor, will be on an extended medical leave between, I guess, today and February. So we have hired an LTE custodian, Maria Perez, or she goes by Janet. And she started on the 1st of the month here. We had an LTE, Rock Chamberlain, who was someone who could fill in, and he has decided to fully retire, so he resigned that LTE position as of the end of October. And then just to share with you the vacant positions that we continue to have, or maybe newly have, that ADRC driver position we're continuing to advertise for. We're advertising for information and assistance specialist. In the ADRC, actually, I believe we're in the process of interviewing. CCS supervisor, we are advertising for, along with the APS worker, that APS crisis professional position that we still have not been able to fill. There's a mental health therapist position, and we still have one psychiatric RN position in behavioral health that is vacant that we're continuing to advertise for. We are also advertising for one case manager position for child and youth services, as well as now the supervisor position for child and youth services. All other positions that are on our books are on hold because we don't have a budget for them. Are there any questions?
I just wanted to let you all know there's going to be lots of advertising coming up. We're really doing a huge recruitment campaign this month and next, largely to hopefully get some of the grads that are looking for employment in December with those new 2022 wages that have been announced but not formally approved. We're trying to list those strategically to clearly saying that they're pending, but to try to get some recruitment, because we've got a lot of vacant positions. I think I ran eight positions that we have that are actively being recruited for right now. Lots of social work jobs as well.
We can't do any incentives or promotions. The county board hasn't decided like, hey, we can increase vacations for all county employees and offer different stuff like that. We're still in the same place that we've always been.
Yeah, I don't believe, yeah, there hasn't been a change in that vacation benefit or other kinds of incentives that have come through. I guess, you know, we had talked internally about that, but I think it really needs to come from finance and personnel and the county board.
I concur.
Hopefully, at some point, our resignations will not outweigh our new hires, but it's like as soon as I get excited about 2 or 3 new hires, and then I get 4 resignations. So that's pretty tough.
With that, I guess we can move on to agenda item 12, which is our staff survey report.
Thank you, Mr. Chair. I do have a presentation that I'd like to share with the board. It's not too long, but I just thought it might be helpful to talk a little bit about the survey that we did to try to get feedback from our staff. This is the 3rd year. So this report is in your board folders, and what I am doing, I'm going to give you a little bit of a presentation to highlight parts of it. This is a 3rd year that we've been conducting a survey as one of the ways to get feedback and input from our staff. So the survey was distributed to all the staff who routinely work at the agency, including our county employees and Southwest Workforce Development Board lease staff. Supervisors were included, but managers were not because we're asking questions about management in the survey. We did not distribute the survey to our temp casual employees or our volunteers, so we did have some limits as to how that was done. So we used the same core questions from previous years so that we can compare year-to-year responses. This allows us to note maybe improvements, things that we're getting better at, or declines in staff opinions. We also repeated the COVID-related questions that we used last year to help us compare any changes in staff sentiment about our responses to the COVID crisis. And because we've been seeing such a high turnover rate in staffing this year, we added some open-ended questions related to staff retention to see if we could get some feedback on that. So the surveys were completed anonymously, but we did have a checkbox on the survey form so that we could identify each respondent's program unit. So a total of 61 surveys were distributed. 33 surveys, or 54%, were returned back to us. In 2020, the return rate was 65%, so we were hoping to get a higher return rate than we did. The chart here shows the distribution of surveys returned by each program unit. And there were 5 surveys where the program unit was left blank. So for surveys in general, the average survey response rate is right around 33% when anyone puts out a survey, especially consumer-related surveys, but surveys in general. So a survey response rate of 50% or higher should be considered good in most circumstances. High response rate is usually driven by high levels of motivation to complete the survey or a strong personal relationship with whoever is asking you to complete the survey. Survey response rates in the range of 5 to 30% are probably the more typical survey rates. But knowing this information about surveys in general at least gives us a sense of validity to the information that the survey provided, because we were hoping for more than a 54% return rate. So with 33 people returning surveys, it might be helpful to note that one person's response will shift the survey result by about roughly 3.3% in one direction or another. So 3 people would shift a response 10% in that. So when you're looking at the percentage, you kind of know that if you see a 3% change, that was one person just making a different response. So I'm going to highlight just a few of the questions, but for the sake of time, I just don't want to go through every question. There's quite a few on there. But because I'm not going through all of them, please don't hesitate to focus on any of the questions, whether they're highlighted or not, if you have questions or want to speak about something. Each question page gives a quick overview of the responses to the question and the comparison of the previous 2 years of surveys. You'll also note that there's information on how many respondents felt that their answer was affected either more negatively or more positively because of COVID. You can also see any comments that staff made in addition to rating their agreement or disagreement in the questions. So just to point out, the gold represents 2021 this year, and the tan is 2020, so that just coincides with the table below, and brown, of course, is the 2019 answers. So this question comes from page 12 of the survey on receiving feedback. It shows a pretty consistent low agreement rating and somewhat high disagreement over the last 3 years. It hasn't changed a lot. So in terms of agreement, about 80% would be desirable in my mind. The 70s would be okay, but the 60s or below it would be concerning, or something that I want to know more about. And I think we would want to see a disagreement at 10% or lower. Any disagreement above 15% would be noteworthy, because people generally don't select disagree or strongly disagree unless they really have a concern. So this topic on receiving helpful feedback with staff, agreement of 65% and disagreement of 21% would be an area where it would be helpful to get more input from staff to better understand specifically what staff are looking for in terms of getting feedback and what they feel is helpful. So these two questions focused on a sense of mission. So having a sense of satisfaction in doing one's job, that's on page 13 of the survey, and a sense that mission is important. That question is on page 15. It shows a pretty high level of agreement and pretty low disagreement with these statements. And this is something we're really glad to see consistently from our staff over the last 3 years, that sense of mission is really important to them. These questions focus on team. Page 19, that coworkers are committed to quality. This has remained pretty steady with staff agreement, but we do see some improvement with less staff disagreeing with that statement. Similarly, on page 20, focuses on teamwork, shows that there's been improvement in the level of staff agreement with that statement. And the disagreement has not really changed much in previous years. So there looks to be a little bit of improvement. These are not numbers where we want to see them, but there's some hope that that's getting a little bit better. In terms of questions related to leadership, this kind of highlights the importance of noting that sometimes the feedback can seem conflicting and requires more information to really understand what it means. So here from page 25, the question related to communication between leaders and employees shows that only 55% of staff agree with that, which shows a pretty significant decline from previous years. But on page 29, the question related to being informed about changes affecting one's job shows 88% of staff agree with that, which is also showing an improvement from previous years. So to really understand what these responses mean requires a lot more follow-up with staff. Surveys can only be one of the tools that we use to get input. The survey questions related to retention on pages 32 through 34 seem to reflect greater dissatisfaction among our staff. We're certainly seeing that just with the retention issues that we just reported. These responses definitely reflect that staff don't see themselves continuing with the county. So those seeing themselves here 1 year from now is at 82%, 10 percentage points less than last year. Staff seeing themselves here 3 years from now is at 56%, which is 13 percentage points less than last year. And there's a much higher percentage of who responded with disagreement with this statement. And staff seeing themselves here 5 years from now is at 45%, also with a high disagreement with this statement. So significant amount of staff who don't see themselves here in the next 5 years. It is interesting to see many of the responses this year in 2021 are pretty similar to 2019. 2020, we saw a little bit higher responses in terms of staff seeing themselves here in the longer term. There weren't any comments that focused on why staff don't see themselves continuing to work at Health and Human Services, but there's some helpful information in the retention related questions later on in the survey. Not sure why 2021 compares pretty closely with 2019. It may be that staff were more settled because of the pandemic in 2020. And there's more of a sense of moving now that even though we're still in the pandemic. The other thing that happened after the survey was given last year, staff learned that there wasn't going to be a raise in 2021. And it's hard to know how that might have affected people's seeing themselves being here as less likely. So these questions, you'll note that there is only, I'm sorry, did someone have a question? Okay. You'll see on these questions that there's only 2 years of data with COVID related questions since the pandemic really just started in 2020. These questions from page 35 and 36 show a good level of staff confidence in how we're responding to the pandemic within the agency, feeling that leadership is concerned about their health and safety and has taken appropriate action in response to the pandemic. Happy to see that. But staff comfort level with communicating concerns or taking action if they're feeling unsafe that are shown here on pages 38 and 39 have significantly declined in the last year. They were pretty high rates of agreement with those in 2020, but they've really dropped. We need to examine this further so we can understand what we need to do to assure our staff can communicate their concerns and feel more supported. So this question from page 41 about staff stress related to COVID is one that we would want to see a low agreement and a high disagreement rate. So 42% of respondents indicate that they're feeling stressed, with 21% disagreeing that they feel significantly stressed by the COVID crisis. And a pretty high percentage, 36%, indicate that they are neutral about this. So not good to see that we do have a significant number feeling stressed with the pandemic, but a greater number of people are not overly stressed by it. So the last 6 survey questions were new and focused on helping us understand concerns about employee retention. They were all open-ended to allow for broader input from our staff. The downside of providing open-ended responses is that it's harder to compile responses into trends or to compare responses from one year to the next. But it seemed like this was a better way to try to get at how staff were feeling. So the first question from page 42 focuses on staff feelings about the proposed wage increase. There were 28 responses. I've just added a few of those responses. Many comments focused on staff feeling grateful and happy or hopeful about the pay increases that they're anticipating. There were comments that, despite being grateful or hopeful, also express concerns about health insurance or that there's more that's needed. The next question from page 43 focused on the health plan or health insurance plan. There were 27 responses to this question. Many comments focused on concern for the increased cost of the premiums for health insurance and the high deductibles. There were also comments indicating that staff would feel a need to be careful about trying not to use their health insurance because of the cost. And on page 44, focused on what keeps staff working at Health and Human Services. There were 27 responses to this question. Most answers focused on having a sense of meaningful work, flexible and positive work environment, good coworkers and leaders, and benefits, especially the retirement system, the state retirement system, but also health insurance and vacation. The next question focused on what might cause staff to leave Health and Human Services. This comes from page 45. The vast majority of responses indicated that staff would leave if wages didn't continue to improve or if concerns about health insurance costs were not addressed. There were also 2 responses that expressed that vaccine mandate would cause them to leave. And then this question focused on asking staff what Health and Human Services should do to improve retention. There were 22 responses. Feedback overwhelmingly focused on improving pay and insurance. Other feedback focused on improving employees' sense of being appreciated or valued, addressing workload and training concerns, and improving vacation benefits. The last retention-related question focused on general suggestions to Health and Human Services. There were 20 responses. Feedback here also overwhelmingly focused on improving pay and insurance. Other feedback focused on assuring a positive work environment with good leadership and opportunities for professional development. And again, I'm only included a few of the responses to try to represent what we had from staff, but certainly you can see all of them in the report. And then finally, we have one final opportunity for staff to provide comments or feedback. It's not really appropriate to be able to generalize these comments. There were 9 responses, or 9 staff added additional feedback on their survey. So we can't really generalize them to represent all or a majority of staff. But the staff who did respond provided some pretty thoughtful comments. Some were very specific to programs. Others echoed concerns about pay, insurance, and vacation benefits. Most of these comments are longer. So I'll let you go ahead and read them from the report as you like. I just pulled out a couple here about the importance of work-life balance and changing workforce, and then kind of a sense that feeling like the county board is recognizing workers as assets.
Looking through these prior to the board meeting, when we received our packets, and then kind of reading these, I really like how employees gave their feedback to us. And I think that this needs to happen throughout the county, wise, to help us make decisions going forward. But I don't know how that works out in the end, I guess.
Well, I certainly.
I'm appreciative of it anyway.
Thank you. I appreciate hearing that. I know it's really helpful to us as a management team, which actually kind of just my final slide here is kind of the next steps. We will use the survey responses to help inform our annual agency goals and objectives. Our leadership team has gone through an annual planning exercise each January and February for the last 2 years. And so this will be our 3rd year when we do it again coming up. Because interpreting the meaning behind survey responses is not always clear, we will also focus on some other means of getting staff feedback. I'm going to continue to conduct 3-month check-ins with new staff and do the exit interviews with staff who are leaving their positions. That's been very valuable to hear what people have to say. I also plan to begin conducting check-in meetings with our ongoing staff to gather their thoughts and suggestions. And as a follow-up to this survey, we will conduct some staff focus groups to help us understand better the meaning behind the survey responses that we have here. Sometimes the numbers just really can't tell us the full story, or we might think it means one thing and staff kind of can have an opportunity to clarify that it means something else. So I appreciate the time and just sharing this with you. I think last year I just shared the report, but I did want to make sure that we walk through it a little bit. So thank you. Does anybody have any questions?
No questions?
No, but I do want to add on as well with you, Carrie. Thank you to Tracy and everybody who put this together and have been gathering this information the last 3 years. I do think that's really helpful, and I really liked the addition of looking at the trends from the last few years as well. So thank you for the work.
Appreciate it.
And then I'd like to personally thank the staff for providing their feedback for us. It's very helpful, at least to me it is. I'm making some decisions we have to make. Thank you. If there's nothing else, then I guess we'll move on to our next on our agenda is number 13. Review and respond to a drafted strategic plan and documents. So I let Ingrid handle this, I think, if Tracy and Ingrid want to do that.
I'll just ask you, Ingrid, I put some of the documents that the strategic planning committee had asked into your board folders, along with the email that kind of outlined the questions that they would like addressed. That's all I've done. So I guess however you would like to proceed, if you want anything up on the screen, just let me know, we can put it up.
Well, first off, I mean, I know you had responded to one of our first we had a pilot survey, and you were one of the department heads that we reached out to. And so we appreciated your feedback on that. Sorry, I got distracted by the chat. Bye, Tim. So thank you for that. And then I guess one of the things I wanted to stress when we sent these, and hopefully everybody, I mean, Carrie's on the strategic planning committee, so he's familiar with the documents, but for the rest of the board members and for you guys,
as managers and the head of the department, we wanted to stress one of the things, and I don't think it was really even communicated in the email, was that a lot of times strategic plans are kind of overlooked or seen as something that's going to get put on a shelf, because to be perfectly frank, sometimes that happens. And so one of the reasons why we formed this strategic planning committee was because we absolutely do not want to see that happening. And so it's only a 2 to 3 year plan. That's one thing. It's not set in stone. And it's mostly not that aspirational, because what we're trying to do is put in achievable goals that have a way to actually measure them. And so what was not included in the documents that were sent are that we are also working on a work plan, which will be attached to the document. And that work plan will include a way to track these goals. And so after the plan has been implemented, the committee will transition to a monitoring committee. And so there will be benchmarks or performance metrics that we'll be continuing to monitor with the responsible parties for the various goals. And so the intent is to make this plan to be very accountable and something that is actually actively being used in the next 2 to 3 years. To that end, we as a committee really wanted input from people from the departments who, first of all, have a lot more insight into these various aspects than we do, and who are going to be impacted by some of the goals and, tactics or things that we need to do to achieve those goals. So that was our reason for first sending this to every department. So we really do want to get input, and we really value the input. We've spent a lot of time going over each portion of this plan so far. And we're not done yet. I mean, we still have to come up with a lot of things that will go on to the work plan part. But what you guys give us back as information will help inform that. So I don't know, Tracy, if you had given us a very thorough response to our initial questions, which were not very specific, and we hadn't given you as much information as we did this time. So I didn't know if you had a chance to look at that again, if there was anything that you would have wanted to add to that. The thing about Health and Human Services that I think you guys do that's already great is you're already tracking a lot of what is statutorily required as far as services, what's not, where you guys are being creative to try to meet the various needs. So I think you're kind of a step ahead from some other departments in that aspect, simply because of the nature too of the work that you do and how conscientious you are, Tracy. So that's been helpful for us. But if you had anything to add, or even parts that you thought maybe were crazy, we want to hear that. And from anybody else who had a chance to look over it too.
I did spend some time with this, and I do intend to actually put together some written responses. I thought it's quite impressive to look at kind of each of the areas that the committee wants to focus on. I think there's some definite focus on things that are really needed to be more planful in the county, that either, maybe we do some of those things within Health and Human Services, but countywide, I think some of those things will be helpful. I think it creates a little bit of angst. We have spent a lot of time, we have quite an involved human resources process that we utilize to onboard staff and make sure people are trained, all of the work that Angie does when we're interviewing and recruiting staff, and the prospect of HR department at some point in the future with the county, I think is a great idea, but we hope to be really involved when we get to those kinds of things, because I think one is we probably have something to offer in what we think has worked for us, which maybe will translate. But two is there's some things, because we're one of the big departments, that we kind of have to be able to manage in-house. And so it's kind of hoping that there's some level of understanding of that. Thinking too about the idea of a finance committee. I think that the or excuse me, a finance department. I think that the county needs a finance department, and I see that
Agree with that.
when I look at the document, and that's I think that so many great things can happen with having, investing in having that. At the same time, I recognize how unique Health and Human Services financing is, and we need somebody embedded in our agency, even if they're part of a finance department. Just by having to communicate across the street, all of a sudden you lose things in translation. Someone needs to really understand our programs, and I imagine other large departments might feel the same way, but kind of figuring out the best way to address some of those things. And that's getting too much into the nuts and bolts, I think, from what you might be asking. But I feel like you can tell that a lot of thoughtful time has been spent on this. There's nothing that I could see that really conflicted with the way that Health and Human Services, what our mission is, or what our role is in the county. I did share, I sent this out to our management staff as well when I received it, and asked them to give their feedback, which I'm still in the process of trying to compile something that I can send back to the Strategic Planning Committee. But I don't know if any of our management staff who've had a chance to look at this would like to share anything. Please jump right in too.
Tracy, I think I know you said maybe it's too specific, but I actually think that's really useful, because we're going to have to get specific when we set a goal. Then we have to start getting specific with how do we actually get there. And so that's where we do need that kind of feedback, and we intend to get more as we get further into that process as well. I do still want to hear if there's feedback from other people, but maybe you could share the first document and I could just hit a couple highlights on it in case, because I know it's a lot to digest. And so maybe if I just highlight a couple of things, that'll make more sense as a whole document.
Is this the one that you?
Yeah, so this would be chapter 1. What we didn't have included yet, I think, was chapter 3, but we have chapter 1 and 2. And then, as I mentioned, there's going to be a work plan, which will be attached either as a separate document or as an appendix. This just went into how we actually got to this. This came through Southwest Wisconsin Regional Planning Commission as part of a grant that they are administering. And so we've been working a lot with Troy of the Southwest Regional Planning Commission to do this. And we initially had 4 meetings with as many county board members as showed up, and then eventually formed this committee to further edit the draft of what came out of those initial meetings. And so if you want to scroll down further, it's going to include basically just an org chart of county administration and government. This was put together, I believe, by our wonderful MS staff. Keep going. I wanted to highlight, I think it's on the next one where it talks about our values and our priorities. So there's so much when you start looking at the county as a whole, it becomes really overwhelming to try to figure out what are goals that our county really needs to focus on in the next 2 to 3 years. Because again, this plan is really only highlighting for the next 2 to 3 years. There are a lot of other things that will need to be addressed as well, which would become like a bigger, maybe a more comprehensive plan. But this is focused on what can we start looking at getting done in the next 2 to 3 years that will help us. And so a lot of it is focused internally because we've been transitioning to the county administrator form of government. And so there was a lot that needed to transition along with that. But these were really the priorities that as a group were come up with for how to frame our decisions. So priorities and then our core values. So priorities were effectiveness. Being efficient and effective helps to reduce costs. As you know, as everyone knows, money is the big issue for the county. Growth, we need to have more growth, focus, improvement, and then our core values. Again, this was with those initial meetings with the county board and some other parties. And so integrity, public service, accountability, and being open-minded. Mission and vision, I did just want to state that those were initially come up, like we started getting what we wanted included in that in those initial meetings. And then our committee spent a long time, I think 4 conversations worth, really trying to hone these down into what actually represents our county. And so they're not very exciting, I'll say that, but we did feel like they do represent what we're trying to get to as far as our mission and vision. So again, just, you know, we're trying to be extremely thorough and take time with each section of this and get as much input as we can. So after just those being kind of the framework for it, then coming up with then what are some of these goals that we need to focus on as a county. So if you scroll down a little further, I know I'm going through this quickly, but I don't want to take too much of your time. And let's see. Okay, so this just talks about really kind of focusing in on the money issue, which is the big elephant in the room always. And, you know, what are some of the challenges that we have when we're addressing this? And what is also the business of the county? So one of the things that we're going to have to be really taking a hard look at, and starting to in this document, but we'll probably be addressing this more significantly in a separate, longer, more comprehensive plan, is really looking at what services, enterprises, you know, what is statutorily required, what's discretionary. And then when we have a better idea, which we're working on that right now with what do we offer already, starting to make some decisions into, you know, are there cuts that have to be made? Are there ways that we can be creative with meeting services that are necessary? And when it comes to discretionary, I do want to just mention, it's not always about the money. It's not that we just say something is discretionary and so therefore we can't, or non-statutorily required, so therefore we can immediately cut it. Obviously, we're not going to take anything lightly. There are other things that non-mandated services offer. And so those are all a lot of big considerations that are going to have to be done. And so these are the questions when it says considerations, when we're looking at those as a county, these are some of the questions that we would have to ask. So I think this chapter 1 really just is kind of explaining a lot of the thought process, and then some of the challenges that we're going to have to start looking at. Chapters 2, the next document, really highlights then some of the goals that we landed on. And a lot of these, as I mentioned, are really focused internally. Chapter 3, which we haven't shared yet, is more focused externally on, and when I say externally, I mean not so much on how the counties run as maybe some of the services that are being offered or the businesses that we are a part of. For example, I think in chapter 3, which these, by the way, all of these documents are available online. So if you want to see what chapter 3 is, it's on the website, Richland County website, but it highlights some of the businesses that we're in, such as Pine Valley and UW Richland and various other things. And so those are going to get addressed more later, but these are really more focused internally on that transition that I mentioned from, we have been transitioning to a county administrator. And what's that going to look like for our county, and how can we make our county meet those priorities and goals that we mentioned? So for example, one of the goals that we're landing on, I'm not going to go over every single one of these, guys, I don't want to take forever, but one of the things that we're looking at is how do we streamline organizational structure to make us more effective? And so as Tracy mentioned, perhaps one of those things as a tactic would be to centralize countywide processes under a county administrator. So she mentioned like an HR department for the county, or a finance department for the county. So that would be a potential tactic, but the goal here is looking at, we need to in the next 2 to 3 years, work on and achieve some streamlining of our organizational structure in order to be more effective. And then another one is right below it, improving financial practices. So for an example of that, which, for example, our county administrator's already been working on developing a capital improvement plan that would really look at all the areas in our county capital expenses that are going to need to be developed, and what is the priorities, what's the order, all of those things into a plan. If you want to scroll down, I'll just highlight maybe 1 or 2 more. Oh, another big one, which I'm sure you guys are all very aware of here at HHS, is the need to increase our workforce and to grow, or to, you know, and at the very least stabilize what we have, right? So when we're looking at that as a big goal, okay, what are some of the then goals within that? And so improving employee pay and HR policies. And then as you can see, it breaks that down into potential tactics or ways that we can achieve that. So those are those potential performance metrics or ways that we can track this, and tactics that we can use to get there. Developing a culture of support was another goal within that bigger goal. Keep scrolling down, I guess. Yeah, and so I'll just kind of stop there, but I just want to stress again that I hear you. We had gotten some feedback already that to the effect of this sounds great, but if it's not actually implemented, then it does us no good. And I hear that, and I completely agree with that, and so does everyone on the committee. And again, that was why we formed this committee, because absolutely don't want this to just be set on a shelf. We don't want to like say these are our goals, they sound great, they sound like they'll be lovely, but we're not actually going to do anything with this. And particularly when we look at the fact that county board, you know, there's a lot of transition there. We're going to have an election year next year, so it could look very different. So the plan is to have this ready by next year, so that no matter who's on the board, there is a plan and a way to monitor that plan and follow up on it for whoever comes next, because these are really important things for our county. And that's another, again, why we're really looking for input from anyone. We're going to be highlighting this in the Observer, planning on putting an article in the Observer. There will be an interview next week on the WRCO with Ron Fruit. So we're also wanting the public to be aware of this and potentially giving input if they are interested as well. But to me, the most important input is for all of you who actually work in our county and in these departments that are a part of it. So that was long. Thank you for bearing with me. But yeah, any questions or input, or you guys are crazy and these are awful goals, please let us know.
I did ask Megan to just be prepared if the Health and Human Services Board as a body want to give any feedback on the plan back to the committee. So I know she will include whatever is stated in the minutes, but and it may not be that you have something specific that you want to send back to the committee, but I just wanted to let you know that.
What I've been doing so far is any responses that I'm getting back, I'm putting it into PDF form and then into our folders so that everyone in our committee can look at it. We'll be discussing all of the responses that we get. I think the deadline, we're shooting for the 19th. So our next meeting's the 22nd. We want to spend that meeting really digesting and going through all of the responses as we move on. So thank you. Anything written that you get back to me will be great.
Dr. Barris, you got anything to comment on?
look at it in its entirety. It's quite an extensive document. But I have to agree with Ingrid that just putting the document out there is one thing, but the follow-up is what's really important on this.
Yeah, that's something that we even got to think about as committee, and then further when we present this on for final approval and stuff, is how do we keep this implemented throughout the years? So like supervisors' term lengths are 2 years, every 2 years. And there could be a substantial amount of change, and like how does that keep working in? And what about the administrator? Like how long will you have an administrator? Will the administrator that we have, will he stay long enough to help us go through this, or is he going to move on and further his career? And then do we continue with an administrator and go back to administrative coordinator if we don't have that? Then how do we keep that moving on there? And it's just very difficult. But there is one thing that I think that we're gaining out of here. It's a very small thing, but we've created one document that tells us what is mandated and what isn't mandated and what is like the services. And there's no other paper in the state of Wisconsin that we know of, and even the counties association has that thing where we can look at it and say, okay, this service is mandated. This is discretionary. There's nothing like that out there. So
I did want to just add a couple of things onto that. To his first point, I will say that currently it is the plan, and what was approved was that the strategic committee, after this is implemented, it will be a committee that will then meet quarterly after that to update and monitor the progress on the plan. So there is some, we do have something set where even if that changes, even if supervisors change, there will still be a supervisory committee that is monitoring the progress on the plan. Second thing is in what he's saying with that document, giving credit to Melissa Luck, she's been working really hard on that. And I do want to say that we also recognize we haven't seen the full document yet. It's a huge undertaking, and some of it's not very clear when you're digging through state statutes. So it's a huge job, which is probably why it's never been done before. But it is also, we're recognizing that there are things that would be called discretionary or non-mandated services. However, understanding that sometimes those impact things that are mandated. And so by default, you kind of have to include them. So I do want to say that even if there's a list that says something that's not mandated, doesn't necessarily mean that means it can just be taken out. It's like domino effect, right? So really wanting to take a lot of time and thought into that too.
So is this next meeting that we're having, is this still on the same ID number and passcode?
Yes, it is. So that
Okay.
joint meeting with Finance and Personnel and the Health and Human Services Board.
Yeah.
What I had thought, once this meeting adjourns, I'll stop the recording so that this meeting will be saved as a recording, and I'll keep the meeting open. I know it's going to start here in about 10 or 12 minutes. And then as people sign on, then we will record that meeting as a separate meeting.
Okay. Your staff is welcome to stay on here, but they don't have to for this next one. This is just brainstorming questions and thoughts is all we're doing. Between the two.
So Carrie, do we need to adjourn our meeting then?
Yep. Well, that's if you're done.
This is Diane.
If you're done.
This is Diane.
Go ahead, Diane. So Ingrid, are you done then with your?
Yeah, I did a lot of talking. So if anybody has questions or anything, yeah, let me know. I'm happy, by the way, anybody from our committee can be contacted. If you even want to email me questions or call me with questions, you know, you don't want to ask now or you haven't thought of anything, you can do that at any time. So yes, I'm done.
Hi, this is Diane Cox. Oh, I'd like
Go ahead,
to make a statement or comment.
Go ahead.
I just want to say, I'd like to say a huge thank you to the Strategic Planning Committee. and for the county board supervisors for really looking seriously at this, because, you know, again, it is a huge task, and I think it's good for the employees to know that everything is being taken seriously, and not just, you know, when there's budget cuts, that things just get whacked away, you know, without there being a thoughtfulness behind it. So I just want to say a huge thank you to everyone who's involved with that.
Thank you, Diane. So without any other comment, I guess I will look for a motion for adjournment. I will make that motion. Would there be a second?
Second,
I'll second Diane Cox.
Okay, so we got a motion and a second for adjournment. All in favor signify by saying aye.
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 Aye. Opposed, say nay. Motion carries. Thank you, everybody, for attending. Those that want to stay on, you're more than welcome. If you don't want to, that's okay too.